Hello, and thank you for joining me in this overview of the American allergy epidemic. My name is Matt Atwood, and I'm the founder of AllergyFree. As I go through this information, I invite you to recognize the opportunity to do things differently, especially when it comes to allergies. With AllergyFree, we simplify allergy care by providing you with the tools to help allergy patients regardless of what specialty you are. My goal is to demonstrate how our program can elevate your patient care and, in turn, provide you with an opportunity to create a substantial revenue stream with patients you already see on a daily basis. As a medical consultant, I'm aware of 3 principles for evaluating new services in your practice, and AllergyFree hits all 3 of these. First, let's start with patient care. When patients are sick, they want help. They have choices on where to go, and they choose you to help them. Remember, these patients are your customers, and when you take good care of them, high-quality patient care keeps them coming back. Second, let's talk about patient volume. Patient volume is an essential to any successful medical practice. When looking for a new service, you want to make sure that you choose a service that provides value to a large population of your patient mix, and yet doesn't disrupt patient flow or slow things down. Lastly, let's cover patient services. Patients love you, and your schedule is fully booked, but now you've plateaued on your revenue. You physically cannot see any more patients, so how do you increase revenue? At this point, you have to do more with the patients you already see. You have to find a new service that can fit as many patients as possible. Wouldn't it be nice to find a program that increases patient care, hits a high volume of patients, and generates new revenue streams? That's where AllergyFree comes in. So what I'm going to do is I'm going to explain to you real quick on the reason why there's an American allergy epidemic. And let's start with number 1. More people, more pollen, more patients. Right now, the American population is over 331 million people. Combine that population growth with increased CO2 in the air to do climate change, which now creates a longer pollinating season, and the plants are producing more pollen. That also creates the largest chronic disease in the United States. Seasonal allergies, which are spring, summer, fall, are the 6th largest chronic disease state. But when you add in allergy-related gastroenterology issues, dermatology issues, asthma, and anaphylaxis, allergy quickly becomes the largest chronic disease in the U.S. Out of 100 million Americans suffering from allergies, more than 50 million are undiagnosed and untreated. Now let's cover the dwindling shortage of allergists. In the middle of an ever-growing demand for allergists, there is a critical shortage of allergists. Remember, in the midst of every crisis lies great opportunity, which means the massive patient overflow has got to be handled by non-allergy specialists. So that's where AllergyFree can create a simplified program to where any medical provider can offer allergy services in their practice. Lastly, the one thing we want to make sure that we try and avoid is symptomatic treatment and misdiagnosis. Most providers assume they lack the time, training, and tools to offer evidence-based allergy care to their patients, which is why most providers just treat allergy symptoms with temporary pharmacological fix. Let's keep in mind that over 100 million Americans suffer from allergies and only half are identified. The CDC says that 40% of adults and 30% of kids have allergies. With that said, on an average day for patients, if you're a primary care doctor or it doesn't matter what your specialty is, if you're seeing anywhere between 25 to 30 patients a day on average, just from basic calculations of 30% to 40% of American population volume, that equates to 7 to 12 opportunities for you to be able to offer allergy care to patients that are sitting in your lobby. So let's go over common allergy symptoms. Everybody knows about the nasal and sinus issues. You got sinusitis, rhinitis, and all of that. That's great. Everybody recognizes that. And when you start taking the medications, it makes you feel like you got a 20-pound bowling ball on your shoulders. I get it, okay? But what we need to look at is you look at all the other symptoms that are allergy related. When you look at dermatological, you're looking at rush, edema, itching, reddening, any of the psoriasis, eczema, hives, those are all allergy related to either something that you eat, something that you touch, or something that you breathe. Vomiting, nausea, stomachache, diarrhea, those are all food allergy related. And any of the itchy, watery eyes with the ears, eyes, nose, throat, or upper respiratory or lower respiratory, everybody knows what those are. So when you take a look at all of these symptoms, how many times do you see these particular symptoms in your practice every single day? Again, think about 7 to 12 patients a day if you're doing 25 to 30 patients. If you take a look at this and you're saying, you know what, how do I treat these patients right now? Here's probably what you're doing. Most primary care physicians will take a look at the list of all the symptoms and they'll go, you know what, this is easy. I think you've got allergies. Let's take the exam. Let's do a patient history and let's prescribe a corticosteroid shot or any kind of lotion, potion, cream, mist, inhaler, anything that can reduce the amount of symptoms, right? To give you temporary relief. From here, you're making about $60 for that patient, for the patient exam only, right? For your office visit. You're not going to be making any money from the short-term solutions that you have to be able to treat the temporary symptoms. So, how do you offer a better plan? We give you an opportunity to be able to prescribe sublingual immunotherapy, and we also give you an opportunity that if you want to do the evidence-based side, is you can do allergy testing. And then once you do the allergy testing, you can coach the patient on what to avoid, what to avoid as far as eating, what to avoid if possible as far as breathing. Now, you can generate additional revenue with the sublingual immunotherapy. If you were to just refer, which I'll go over on the next slide, if you were to just refer patients to us and we do it on the telemed side, we'll give you $10 for that patient's dropper every single month, which is 12 months. So for the first year, you'll make $120 versus that $60 you just made on an office visit. We just doubled or tripled your revenue from the office visit with an additional $120. If you were to prescribe it, we'd actually give you $20 instead of $10. And when you're doing the prescription, now that's $240. We just quadrupled the amount of money that you can make from this particular patient by just giving you the option of doing sublingual immunotherapy. If you wanted to do the testing, we can also generate revenue there, and I'll show you how. So let's go through the 4 provider affiliate levels to choose from. Number 1 is the referral. If you just refer to us, we give you a postcard to put in your lobby, and you can just say, you know what, it looks like you have allergies. Instead of referring you to an allergist, we can just give you a referral here, and then you can get the sublingual immunotherapy on your own. This is more for patients that are doctors that cannot do prescriptions, for example, like a chiropractor. A chiropractor can offer a referral, but they can't prescribe. Unless you're a functional or interventional physician and you've got an MD or a DO or a PA or somebody as a medical director, then you can do the prescriptions. If you do the prescription, then we'll pay you $20. So you can either refer or prescribe at this point, and we'll give you the $20 if you sign up on level 2. If you sign up on level 3, what you'll do is you'll order the blood testing kits from us. And on the blood testing kits, they're super easy. You do a finger stick, you put the blood on the card, you send the card in with the self-addressed stamped envelope, and we will do the laboratory for you. We send you the results and you consult the patient at that point. This will help. And if you do a level 3 or a level 4, we will actually pay you $25 for an affiliate marketing for our drops per month. So when you take a look at our solutions to the allergy epidemic, what we do is we provide you with all the tools and the training to be able to provide allergy care in your practice. We start off with training the providers. Our online platform educates providers on the basics of allergy disease and how to test and treat with evidence-based tools. We simplify the entire process to offer your patients more. Then we also provide a patient education and engagement using media tools to teach patients on how they can live an allergy-free life. Then we provide the sublingual immunotherapy, which is level 1 and level 2. You can either refer or prescribe. And then we also provide the allergy testing, which is level 3 and level 4. It allows you to test for food antigens as well as airborne antigens. And if you wanted to do the skin testing, we offer that as well, along with a full day training in office to train your entire staff on how to do allergy testing in the office. When it comes to sublingual immunotherapy, this is what the droppers look like. Each one of those droppers is a 30-day dose. On the first day, on the first month, you'll get dropper number 1. That's the lowest concentration on the top 90 allergens across the United States. It doesn't matter what region you're in. It doesn't matter where you live. It doesn't matter where you travel. It doesn't matter where you go on vacation or where you move to. You are covered with the top 90 allergens across the country. What that does is that trains your immune system. You microdose every single day. And when you get dropper 1, the patients will take 1 drop under the tongue every day for the first week, 2 drops the second week, 3 drops the third week, 4 drops the fourth week, and then you'll bump it up to the next month. You'll take dropper number 2, which is a higher concentration, and you'll do the exact same dosing. Week 1, 1 drop under the tongue every day for the first week, 2 drops the second week, 3 drops the third week, 4 drops the fourth week, and you'll go all the way through to your maintenance. And when you hit to your maintenance, that is your highest concentration, and you are now in a maintenance mode. Within 5 months, you're taking the maximum dose, and it's 5 drops every day for the rest of the year. At the end of 12 months, they'll come back, they'll do another test. If they prove negative on the test, they are done with the immunotherapy at 12 months. And it depends on how sensitive people are and how long they've had allergies, to where it could be anywhere between 12 to 24 months when they're fully immune to the top 90 allergens across the country. Now, when it comes to blood testing, we provide the kits. Everything you need is inside this kit. So everything from the blood drop card to the finger sticks to the alcohol preps to all of it, everything is in a self-contained kit. Within this kit, we charge you a flat fee, and there are discounted rates. So if you have an increased number of orders, then we give you a discounted rate over time based on volume. And right now, if you were to pay $195 for the kit, you can charge $225 or $250 for that particular kit on the inhalants. And I believe food testing is $150 on wholesale. And you can add an additional $25 to $50 on top of that. Keep in mind that you are paying this as inventory, and you can charge the patient where you can sell them the kit and then they do it at home, they send it in, or you do it there in the practice, have your staff do it right there in the practice, which I highly suggest. You want to try and make sure that you're in control of this process, not the patient. If you were to just do one patient, one test, one patient a day, 5 days a week, in 4 weeks, that's 20 patients at $25 minimum. You can charge $50 if you want. That's $500 times 12 months is $6,000 a year. If you wanted to bump that up to $50, that's $12,000 a year. If you wanted to do that as 2 tests instead of 1, that is $12,000 a year for 1 test, and for 2 tests, that's $24,000 a year. So it is directly related to the amount of volume that you use. When you're looking at the skin testing, that's when you're looking at an insurance reimbursable test in the office, anywhere between $400 to $600, depending on your insurance type. If you were to just do 1 patient a day, that's $200 net on minimum net on that particular patient. 1 patient 5 days a week is $1,000 a week times $4,000 is $48,000. That's only 1 patient. And keep in mind that you're looking at your patient volume, anywhere between 25 to 30 patients a day. Looking at 30 to 40% of your patient load have allergies. That's 7 to 12. So imagine only 1 patient a day. You could easily be doing $150,000 to $200,000 a year on this allergy program by just offering this program to your patients in your practice. So if this sounds good to you, I would invite you to go ahead and click on the QR code down below and fill out your feasibility report. Give us an idea of what kind of patients you are, or what kind of patients you see, what kind of specialty you are, how many patients a day you see, and how many you think would end up doing this program in your practice. And we will create a revenue analysis for you and get this out to you as soon as possible. I look forward to assisting you in the future, and I look forward to helping your patients be allergy-free. Have an amazing day.